Call the March 2021 Health and Human Services Committee meeting to order. I think first up is going to be Jack Mabb.
Okay, thank you for letting me go first. There's a community paramedicine webinar that's starting right now as it relates to COVID and homebound. So thank you again for letting me go first. This first one is about moving money over to the Healthcare Consortium. This is the remainder. We would have gone last month with this. It's a remainder of the impact dollars. We want to move over to the consortium. It makes it easier for us to fund small projects rather than have to go through each individual thing. There's an executive committee which I basically chair that makes the decisions on what we're funding. It's going to be Narcan, enhancing Narcan distribution, medically assisted treatment at the county jail, funding the reentry program or beefing up the reentry program. These are some more community sites where people can dispose of syringes. Some of the things that we're thinking about, but just moving it over in a block and having her administer it. Obviously, this is also parcel of the fact that I'm a little bit busy, and having the consortium pick this up would be a big help.
I'll move it, Morel.
I'll second Patsy.
All in favor?
Aye.
Opposed? So carried.
Thank you. This is an annual resolution. These are the Appendix A, B, and C are the providers that early intervention funds, speech therapist, physical therapist, occupational therapist, those sort of things. It's pretty much a standard thing that we do every year.
I'll move it, Bury.
Second,
second it.
Eldridge, all in favor?
Aye.
Aye. Opposed? So carried.
This is also the early intervention program. As it says, we generate about 50 contracts with transportation for transportation of the kids. This gives the director the authority to bid those things and award those things rather than having the chairman have to deal with 50 different contracts. It's an annual thing as well.
I'll move it.
Second,
Second, Sterling.
all in favor?
Aye.
Opposed? So carried.
Final resolution is for a community engagement facilitator. The folks at Columbia University require at least 2.5 FTE positions. This is the half, if you will. So we're funding half a position through Twin County Recovery Services, and the dollar amounts are listed on the Schedule A attached.
I'll move it, Sterling.
Second,
Patsy second.
all in favor?
Aye.
Opposed? So carried.
Those are my resolutions. As I will tell you that, as some of you might have heard, this is our busiest week. 1,605 doses going in 4 days. Tomorrow, 585. We listed the link for that last night at 5 o'clock, and it filled up in an hour and 5 minutes. All 585. We're going to be posting the link for Thursday and Friday tonight at 5 o'clock, and we're going to be posting the link for Saturday, which is 500. Thursday and Friday, 250 doses, and Saturday is 500 doses, and we're going to be posting that link on Wednesday night. So again, a busy week for us. It's a pleasure. Busy, but definitely a pleasure. I don't know if you have any other questions regarding the director's report.
Any questions for Jack?
I just want to thank Jack and his staff for the amazing work they're doing with these clinics. Very, very professional. Great job. My hat's off to you folks for all that you're doing. Thank you. And all your volunteers as well.
We, as of today, we've done 21 pods. And I do think the good news is I think that, Larry Swartz, who we have a meeting with him on Mondays. He's the governor's vaccine czar. Is by the end of the week indicated he was going to be asking us what our throughput capacity is. I think that means there's going to be more. I think they're gearing up for that time when everybody's eligible for the vaccine. I think we're going to see more vaccine in our hands to be able to push out there, and we're ready.
Thank
All I've heard, Jack, is nothing positive about the
about the pods in the clinic or the vaccine at the college. I think it's great, and everybody's saying how professional your staff is, and so
Yeah.
that reflects on the county as well. So
Yep.
thank you.
Thank
Great
you.
job. Terrific. That's all.
Jack, I have
Go
a
ahead.
quick question. We have a bunch of town employees coming out for tomorrow's pod. Thank you so much. One of them doesn't have childcare. Are we allowed to have a child with us?
Yeah, it's happened.
Okay.
It's happened. You know, after they go through education, they can stay with they pretty much can stay with their parent.
Okay.
Yeah.
Thank you.
Yep.
Any other questions for Jack? Thank you, Jack.
Thank you.
Take care.
Dan, I don't think we have anything, correct?
Yeah, that's correct, Rob. So the resolution that Kelly just put up was pulled, but I'm on the call just in case there's any questions that came up as a result of the report that I submitted. I'd be happy to speak to any of the points that I outlined. And if not, I can just say goodbye and let you guys finish the work that you need to be doing.
Are there any questions for Dan?
I had a question if I'm allowed.
Sure.
Go ahead.
Dan, I just wanted to know, I was on the budget meeting. I understand the resolution was pulled. I understand the reasoning behind it, but what is the potential outcome of not getting those positions in sooner than later as far as your workload and being able to meet the needs of the county residents for mental health?
Well, we're going to be as nimble and as creative as we can for everybody that might not know. We put in a request for two positions being filled, and at this point, a pause was put on that request. So, we are still backfilling for a position that was as a result of somebody's retirement. And then also we had a promotion from one of the line staff positions up into a clinical supervisor position because the clinical supervisor became the new clinic director. So bringing those people on, once we've identified them, once we found the candidates, will help. But they're likely going to be at capacity very quickly. So we want to avoid a wait list again, because the wait list was less than ideal for residents of Columbia County. They had needs that they were articulating to us, and so we're trying to be very efficient in our existing caseloads. If people are not attending their sessions regularly, we do outreach to them. We try to emphasize to them the importance of making their sessions. And if they show a pattern or a tendency of not making those sessions, we move towards discharge so that we can free up room on each clinical staff person's caseload to take on the new cases that are presenting themselves at our doorsteps, so to speak. So that's our approach. That's what we're left with. We won't be able to oblige the college's request. President Drummer has been very patient with us. Some of you may remember we have a resolution and agreement to provide behavioral health services at the college to the student body of Columbia Green Community College. It's an annual agreement in the amount of, I think it's $23,000 or $24,000 for us to have a behavioral health professional out there for, I think it's between 7 or 10 hours a week. We won't be able to oblige that request just yet. That's one of the casualties of this decision. So, I'll keep everybody posted. I'll certainly keep Chairman Lagonia posted as to how we're doing, how we're managing. But we understand the logic around this, and we're going to do the best that we can with the existing staff.
I just want to make sure that everybody knows that it was brought to the budget meeting, committee meeting. The committee is receptive to it. It's just a matter of, I think what we're waiting on is to see what the aid is actually going to be. to the county, at which point they're going to have to adjust the budget. And these would be two of the items, two individual spots that they would obviously be important to the county. So again, I don't think it was a hard no, but it was just a sort of sit back for a little bit until we can figure out what the finances are going to be, because this was not a budgeted line item. So I appreciate you working with us on this, Dan. We know how important it is to the county, and I think everybody understands that. So we're in support of that. Just have to figure out the budgeting aspect of that.
Yeah, I appreciate that, Chairman. I mean, we're optimistic. We know that you all know these are revenue generating positions, but we know that the approval has to be done in a right way, in a timely way. And we'll do the best we can as we, wait for that approval.
Yeah, if I could just add, we still haven't received the guidelines of how we can use the stimulus money. We're expecting that by the end of the month or end of March. And then we'll have some more information of what the money can be used for and what's acceptable. So until that time, I just think it's prudent for us to wait and know exactly how we can use the money, and then come up with a plan of how we are going to use the money. And as I said at the budget meeting, amend the budget once. Let's not amend it, every time something comes up. Then it becomes very, very cumbersome. So if we can come up with a package, just like we came up with a package to reduce the budget with several items, we should come up with a package to increase the budget to get, all in one resolution.
I had a question. I'd like to ask the question, Dan, just slightly differently. Do you know how many openings we have as of the end of the month compared to the same time last year? How many staff openings?
Could you repeat the question, Supervisor? You broke up a little bit.
How many staff openings do we currently have compared to the same period last year?
Well, at this time, there were several budgeted vacancies that we had, but in an effort to, I think, reduce the deficit, those budgeted vacancies were taken back by the county from all of the departments. I hope I have that correct. So this time last year, let me just think off the top of my head, I would say there were easily 3 or 4 due to retirements that we had, people moving on to other employment opportunities, and also people relocating. So keep in mind, we were in the midst of the hiring freeze at the time. So, we had vacancies that started as far back as, I think it was December 2019 is when the vacancies started. And shortly thereafter, we had a few retirements, a few people leave for other employment opportunities. And as we were on the cusp of filling out resolutions to ask for them to be filled, it is when the hiring freeze occurred. So we made it through the majority of 2020, and then it was in the fall, I believe it was August, was when we got the first approval from this home committee to fill a clinical vacancy. And then shortly after, we got another approval, and we've brought both of those candidates up to speed. They're on the verge of being at capacity. And then now we have, this latest retirement, and then also the moving up of one of our line clinicians into a supervisory position. So we're backfilling those, but that just brings us back to where we were. So, we were also, and I didn't mention this earlier, we're on the verge of operationalizing a virtual open access. Open access was our walk-in clinic. That's how prior to COVID, we would bring people in and, initiate the admissions process. So we had to retool that as a result of COVID and the realities that we're not doing anywhere near the kind of face-to-face work that we once did. And we don't know yet how much face-to-face work we'll be doing in the future, because people have responded very favorably to telephone and video as an option. So, without having approval for these 2 positions, we don't feel that we can, make an announcement to the community that, hey, we're open for business and here's a virtual open access mechanism by which you can access our behavioral health services. So that's another impact. But like I said, we're going to work with the existing staff that we have for as long as we need to. And you know, short of advertising this new open access system, this virtual open access, people continue to call us on a daily basis, and we've been able to find room for them on the existing clinicians' caseloads. But again, I'm really emphasizing to all of my staff to be very diligent about, you know, cleaning up their caseloads and not holding on to individuals who aren't actively participating in their therapy and being part of the process. And we tell those folks when we notify them of their discharge, they're always welcome to come back. But you know, the stipulation is you have to make use of this service. You have to be a participant in the process. So we're hoping that by being more efficient in that way, we can manage the incoming need as it presents itself. But we're certainly not going to communicate and market ourselves as having a virtual open access system to accommodate, you know, anyone and everyone that might be interested, because that wouldn't be possible at this time. We would need the additional staff to do that.
So I have one more question. Understanding all of the parameters or caveats that you've given us, how do you, more importantly, evaluate what the need is, particularly if we're cleaning house of people who are, I mean, I would think that people who need mental health services may not be in the best shape or in the best position to, you know, to follow their treatment plans. And so we're cleaning house and letting them go so that we can make room for other people. So how do we really assess what the need for these services is? Because what I'm reading nationally and statewide is that these numbers are way up. And I don't know if they're way up in Columbia County and or if they're flat in Columbia County. It's hard to tell.
It's hard to tell because remember, we've been coming off of, you know, kind of a period of time where we were all under furloughs as a county department. We had the hiring freeze. So we were using the wait list as a holding pattern, so to speak. We had 100 and I think it was 68 people at the most on the wait list at a given time, which by the way, we've absorbed the majority of that. We made a conscious effort to say, you know, enough. We have to bring these people in for services. And we did that, which is what also affected our capacity to take on, you know, more referrals. So, you know, in terms of judging what the need is within Columbia County, it's hard to say. I would imagine, excuse me, I would imagine, and this is only my educated guess, that, you know, logically speaking, we are likely going along with what's out there in the rest of New York and the rest of the counties and the rest of the country. I mean, it would be illogical to assume that Columbia County is any different, right? Because people are struggling, people are suffering, people are incredibly stressed. However, we've been working with the same group of people, the same group of clients, because that's what we've had. We haven't been able to bring in new clients until recently. And the new clients that we brought in were the ones on the wait list. So we haven't yet sent a communication to the community saying, hey, here we are, the Columbia County Mental Health Center. We are wide open for business. Anyone that has a wish, want, or need is welcome to approach us. Because to do that at this point would not be prudent, because we don't have the capacity. The people would come and we wouldn't be able to serve them. And, you know, I understand the reasons for that. I understand why, you know, Chairman Morrell and Chairman Lagonia, you know, needed to take the actions that they did. So at this point, we're doing our best to meet the need that happens to present itself, but we're not actively advertising or inviting the community need to end up at our doorstep, because I think everybody understands, I keep repeating it, that would be irresponsible, because if I did that and, you know, X number of people showed up and were eligible for services, but that would mean I'd have to have caseloads for my therapist close to 100. And that's not appropriate. That's not good care. That's not taking care of our employees. That's just not sustainable. Right now, some of the staff's caseloads are in the high 70s, 80s, and one or two of them are hovering around 90. And if you've never done the work, just know that a caseload in the 90s is extremely difficult to manage, especially if the clients are showing up. If their kept appointment rate is high, if they're showing up for the appointments, then you are very, very busy and potentially headed towards burnout.
Thank you for trying to explain it. I really appreciate your making that effort.
Okay.
Did
I
I think
answer your question?
I think as best you could.
Okay, thank you.
Mr. Chairman, if I could, I also just want to point out that one of the agreements we made with UPSU, the union that represents most of our employees, when they agreed not to take their raises for 2021, was not that we not create or hire any new positions during that period. And I think within the next couple of months, that will shake itself out with the stimulus money and so on. But we had an agreement with them that we wouldn't create any new positions during this time, at least while they're not taking their raises. And I failed to mention that yesterday at the budget meeting, but PJ, can you, that you were at that meeting as well?
That's correct. And then we were going to review it in July.
So.
Thank you for that clarification. Supervisor Mussman, did you raise your hand?
Yeah, I was just wondering why couldn't we salvage the Columbia, the college position somehow, or is that impossible? Will we at least cover that?
At this point, I don't have a staff person that I could allocate there. I just have no one that I could offer. Everybody that I have, I need in-house at the Hudson site to serve the existing census of clients, especially since we absorbed the wait list and because we are, how shall I put it, quietly responding to the day-to-day calls that we're receiving and finding clinicians to serve those individuals that call us. So without being approved for an additional staff person, I have no one that I could dedicate to the college for that amount of time on a weekly basis.
But Dan, I do want to point out though that, we had quite a substantial waiting list, correct, when you took over?
Absolutely. As I said a moment ago, I think the highest it got to was 168, maybe 170. It's down to, just for everybody's information, it's down to, I believe 32. And all 32 of those cases are unfortunately children. The reason is that we couldn't take the children off the wait list is because the individual that retired most recently, as in a few weeks ago, was a children and family therapist. So we scrambled to absorb his caseload of mostly children. So not all of our adult therapists are trained adequately to serve the needs of young children. They can get by talking to a teenager, let's say, and providing talk therapy to a teenager. But our adult therapists don't have the cross training to be able to conduct, let's say, sand therapy, play therapy in a proficient manner. So very quickly, the remaining children's therapists, caseloads went up dramatically to the point where they were at capacity. So we weren't able to, unfortunately, at this time, take those children off the wait list. In hiring for that staff person's replacement, the backfill, we're doing our best to find a clinician that's interested in employment with us that has significant children's background experience. That's proving to be harder than you might think. So, we're still very optimistic. I'm waiting to hear back from a very promising candidate this Friday to see if she's going to accept my offer. But she was very upfront and said, I have multiple offers elsewhere. I'll let you know on Friday.
Well, my point, Dan, is that we've come a long way where we had 160. We've taken 130 some odd individuals off of a wait list, which is a very positive. So, we don't want to lose momentum. We'll continue the conversation. And I think it's important that we focus on mental health in the county for sure. So good job to where we've come. And I appreciate you keeping us up to date. And let's continue the dialogue for sure.
Thank you, Chairman. I appreciate you bringing us to that point. I'm also very proud of all of the employees for the way they've responded to the wait list. And, we made a decision as a group that we were going to, eliminate that wait list because it had been a wait list for far too long. And we did that for the most part. So thank you for bringing that out.
Great.
Yeah.
Any other questions for Dan? Thank you, Dan.
Okay. Thanks, everybody. Have a good afternoon. Bye.
Who do we have next, Kelly?
Office for the Aging, sorry.
That's okay.
Thank you. Okay, I've got 5 resolutions. The first one is just a general resolution asking for permission for us to contract with the Healthcare Consortium to provide outreach and application services for the Medical Improvements and Patients and Providers Act, known as MIPA, in the amount of $3,405. We contract with them for most of our MIPA service, our MIPPA services.
I'll move it, Morel.
Second.
Patsy.
Second, Patsy. All in favor? Aye. Opposed? So carried.
Okay, let's see. What's the next one? I can't see that well. My glasses are not that good. The next 4 are actually modifications to our budget to expend money that was left over from last year. The state has given us new deadlines as far as using this money, so we're glad we didn't lose it. We're actually, the first one I have. I don't know if that's the.
It follows your agenda, Kevin.
Okay, it follows my agenda. Okay, then the next one is the request for permission to modify our budget regarding money that was available from the CARES Act.
Yes.
We had $2,766 left over from the CARES stimulus funding, and they've extended it out to September 21st, 2021 for us to use that money. So like I said, we're asking to modify our budget. It's gone through. Ron Caponero has looked through all this and given us his stamp of approval. Like I said, it's money coming in and then it's money going right back out.
I'll move it, Morel.
Second.
Fury.
Fury. All in favor? Aye.
Aye.
Opposed?
Aye.
Carried.
Okay, and let's see. That was the wrong one, wasn't it, Kelly?
No, that was
No.
correct.
No, was that the right one?
Yeah, that was
Okay.
correct. The
I don't
next
have
is your
my
MIPA,
agenda in front of me here.
6,720.
$6,727 is the next one, Kevin.
Okay, we're asking to modify our budget to use the unused funds from the MIPA program from last year. And we have until September 29th, 2021 to use those funds. And we want to use the majority of it towards advertising.
I'll move it, Fury.
Second, Patsy.
All in favor?
Aye.
Aye.
Opposed? So carried.
Okay, and the next one is to modify our budget to utilize funds from the New York Connects Aging and Disability Resource Program. We have money left over in the amount of $14,000, and we want to expend that through September 30th, 2021.
I'll move it, Sterling.
Second.
Second, Morel.
Well, all in favor?
Aye.
Aye. Opposed?
Aye.
So carried.
Okay, and my last one is to modify our budget to use unused funds from our Title C1 program, which is basically our congregate meals program. to use the $36,000 that we had left over from last year and to use it for this year. We haven't, let's see. Oh, I think we have to the end of the year to use that one. And we'll use it. I can guarantee you we'll use it.
I'll move it. Patsy.
Eldridge will second.
All in favor?
Aye.
Aye. Opposed? So carried.
Okay, that's it as far as the resolutions go. It's been a trying time this past year, believe me. But I think we've managed to get the meals out. My main concern through this whole thing was to make sure that COVID did not hit our kitchen. We've had a couple of close calls. It didn't. And we've been able to get meals out every day ever since this started. And I'm really proud of my kitchen staff. They've done an outstanding, a phenomenal job getting the food out to the seniors for our Meals on Wheels program. So that's where the majority of our efforts been. And just lately, most of our efforts been going through, assisting Jack with his vaccination programs. We work very closely with Kelly with their call center as far as providing lists of people that over the age of 60. And like I said, that's where we've been concentrating most of our efforts as of recent. So, but other than that, we're holding our own. Sometimes just barely, but we're doing it.
Thank you, Kevin. We appreciate the extra effort. Are there any other questions for Kevin? Thank you, Kevin.
Kevin, Patsy,
Yes.
real quick. Kevin, are you planning on, they asked me in Malaysia, are you planning on ever opening eventually?
Yes.
Like that site in Malaysia or any of the others?
Yes, we just had a conversation today about that. We're hoping to maybe, sometime in the spring, depending on, like, the only thing that concerns me right now, or not the only thing, is that these variants that are out there, as to, because most of our people, they want to get back. Our people, like you said, you're not only hearing it up in Malaysia, down in Livingston and Gallatin, people, they want to go back. They missed the socialization. So we're gearing up to reopening, provided we don't have any more setbacks.
Well, you let us know what we can do
I
to
will.
help you. Okay?
Well, right.
And I'll
As a matter
have
of fact,
Kathy help you.
We're moving to a new site up there, correct?
The church one?
Yeah, St. Luke's Church.
Right, yes.
That's where we're going to be going. We may be open more than 2 days a week there too. We're contemplating that now too.
Well, and the whole thing is that the senior one in Malaysia, she doesn't want to open that one. I don't know if the new mayor starting April 1st will want to open that, but I think it's too small for the amount of seniors that want to be able to get together.
You're right. That's the other thing that we're looking at, especially with COVID and maintaining, that six foot social distancing. That's what scares me. And as long as, Kathy Eldridge is on here, that's what scares me about Greenport. Because they're sitting on top of each other there, and
Yeah, they are.
I don't know what we're going to do. That's a conversation we're going to have down the line, Kathy.
The CDC has come out now that it's a 3-foot rule rather than a 6-foot.
Okay.
But I don't know if New York State's adopted that as of yet.
Okay. Because like I said, most of our people are getting the vaccine. All the ones that we've talked to, there's been very few and the few that haven't gotten it, they're waiting kind of to get clearance from their medical providers before they do that. We have some people with some allergies and stuff like that, but for the most part, the seniors have welcomed this vaccination.
Well, let us know, okay?
Will do. I will. I'll keep everyone posted. I promise.
Thank you.
One of the things that bothers me the most about opening up the senior centers again is that the lack of mobility that so many of the seniors have had to go out and some of them haven't driven in a year. You know what I mean? They haven't gone anywhere because they've been, my mom, for one, she'll never drive again. She just can't. So that's
well, the other
concern.
thing that we've got two two vehicles, okay, that we've been using, or that, we can use for that purposes. Like I said, right now we're using them primarily for shopping and drugstore and banking things for the seniors. But like I said, there's some downtime in between where they could probably pick up some people and bring them to a senior site and then come back and pick them up.
But we'd make sure my mom got there and, we'd make sure that, the people that in my mother's neighborhood would get there and that went to the senior center. It's just like a scary thought in general in the community that some of these elderly people, they were 85, 86. I mean, my mother just turned 94. She was driving last February. Not now.
Mm-hmm.
The cognitive decline of so many.
Right.
Just
That's
something for all supervisors to be
Right.
Looking at and talking
Well, like I said,
about it.
we attempted to reopen, I think back in October. We had the Livingston site open and the Stuyvesant Falls site open for a couple of weeks, and then when the numbers really started skyrocketing, we said we had to close the doors. We didn't have any instances in those places, but out of a precaution, we decided to pull out because they did have that problem over in Greene County. It got in one of their congregate centers and it spread like wildfire. So,
Well, when you're ready, you let me know, and I will help you with.
Will do. I appreciate that. Thank you.
Yeah, you know that. Thanks, Kevin. We'll have to get a COVID cab with the stimulus money.
Rob, you're on mute, and Linda's got her hand up.
Yep. Supervisor Mussman, you have a question?
Yeah, Kevin, I'm curious whether, you made that rental deal with places like Hudson. I'm curious whether that just was put on hold, or are we still paying for those sites even though we're not using them?
No, we're not paying for them. They're all put on hold.
Okay, great. Thank you.
And actually the Hudson, there's going to be a new site in the Hudson. Well, I call it new, but it's been in the works for some time. But due to COVID, we just never got there. We were, I think, as most people know, we're on the second floor of the library building, and which I don't know how great of an idea that was to put the seniors up there, but anyway, we're going to be going to the Hudson Fire Station. We've been there. We've worked it out with the chief. We're in the process of getting a contract together with the mayor, and like I said, it's much more conducive to the seniors. There's no having to go upstairs or downstairs, no floors. They have the capacity to. There's a room divider, where if we want to do some programming, so we can separate them from the people that just want to go and play cards. Like if we want to do a Tai Chi class there or something like that, there's a door divider that can separate. It's an ideal situation for us. Plenty of parking. That was the major problem at the library, was the parking.
Okay, so you're not only taking the meals out of Hudson, this senior space, but you're also taking programs too. I didn't know that.
Yes, yeah, we do programs there too.
I understand that, but I didn't know you.
We do programs in all of our meal sites.
I understand, but Hudson was doing programs at the senior center, and all of those are now going to the firehouse. Right?
That I don't know. I see, because
No,
Hudson was kind of a unique situation. The county was there, and also the city had their own programs going on, because there were some exercise programs going on there. As far as I know, Linda, they're staying there.
They're all
The
online
exercise
right now.
program, yoga. I think they're staying there.
Yeah, they're all.
So you're adding more. Is that what I understand?
Yeah. Yes. We'll be doing some other program now that we've got the space.
All right. Thanks.
Someone else had their hand raised. I can't tell here who that is, but
that was Supervisor Hoatling.
Okay.
I apologize for my ignorance here, but you talk about programming. Is this just for like Hudson and Greenport, or is this for all towns? Because I don't think we get Meals on Wheels.
We have, when we're fully functional, we have 8 senior centers around the county. Okay, and some of them are open 2 days a week, some of them 3 days. Hudson was for 5 days. Greenport was 5 days. The larger turnout places were 5 days. But anyway, every one of them we have programs for. Either whether it be our big one is we contract with the health department for the Tai Chi classes. They've got certified instructors, and we move them around from place to place. We have a registered dietitian on staff, and she goes and she'll do like a diabetes education program she makes sure she hits all the sites at least twice a year with different
Do you know
types of
what your
programs.
closest site is to New Lebanon? Are you in Canaan?
Probably Canaan. We're up there one day a week. It's on Wednesdays.
Okay, I'll touch base with Supervisor Adams then to get that advertised to more of my residents. Thank you.
But like I said, all of them are closed right now, and we're hoping to open sometime in the spring as long as there's no more outbreaks.
Thank you.
You're welcome.
Any other questions?
Yeah, I have another comment to
Go ahead.
Kevin. We wanted to invite you to our caucus, so I want to make sure you got that message.
Yes.
Okay, you got
we're
it?
all set. I think we're all set.
All right.
I sent to Supervisor Hodling, I sent her a program services guide from our office. I just want to make sure she got it. If not, if anybody wants that, I'd be glad to mail it to them prior to that event. Because that's the main thing I'm going to be discussing.
Thank you. I'm waiting for it to arrive in the mail, and then I will scan and email it out to
Okay, I sent it to your town hall address. That's where I sent
Perfect.
it. Okay.
Thank you.
Yep.
Is this presentation that Kevin's going to do something that all supervisors would benefit from?
Everybody's certainly welcome to attend. We as a caucus have decided every month to have a different kind of department report. So we had Bob Gibson from DSS last month. We're inviting Kevin this month. And certainly anyone who would like to attend is more than welcome to.
Okay, or do it as part of a board meeting.
Sure.
All right.
Okay.
Thanks.
You're welcome.
Any other questions? Like I said, I can't tell if there's hands beyond the screen here. So, okay. Thank you, Kevin.
You're welcome.
Next is DSS.
Mr. Gibson?
Thank you, Chairman. I do have 4 requests today. They are all to fill positions that have become vacant of late. I explained in budget yesterday, in pre-budget yesterday, that it still keeps me at the levels that we were going to stay at. So I do not exceed those levels, but they are 4 positions now that have become vacant and must be filled. The first one is a senior caseworker position, base salary $60,000. I request to fill that and any backfill created therefrom. That is due to a retirement. I'm sorry. That one's due to a resignation.
I'll move it, Morel.
Patsy, second.
All in favor? Aye.
Aye.
So carried.
Okay, the second one is for a budgeted caseworker position, grade 15, base salary $55,000. I would ask for that to be filled and any backfill created therefrom. That is the retirement position at this point.
This one says resignation on it, Bob, just so you know.
Yeah, I mean, she's moving on. She's been with us, so that should say retirement.
Okay, that's fine.
Glad that you brought that up.
Mm-hmm. I'll move it, Morel.
Adams will second.
All in favor?
Aye.
Aye. Opposed? So carried.
Okay, the third is a child support specialist position, grade 12A. That particular person is remaining with the county but has moved over to another department. So I look to fill that and any backfill created therefrom.
I'll move it, Bury.
Second. Patsy? All in favor?
Aye.
Aye. Opposed? So carried.
And the final position, I just got this notice last week. A keyboard specialist is going to be moving on, just out of the agency and out of county government altogether. I just got that in under the wire, and we do need to backfill that. So that's a base salary of $33,000. It's budgeted. I'd like to fill that and any backfill created therefrom.
Patsy, move it.
Second.
Second, Fury.
All in favor?
Aye.
Aye.
Opposed? So
Aye.
And that was the last of my requests. Again, I'm going to stay on the line through the end of the calls to answer any questions about my department or any other department that I can assist with.
Supervisor Eldridge, you have a question?
Hi there. Has the Galvin Motel issues, have they been rectified yet?
As far as with the town of Greenport?
Yes, with the hot water heaters and
yes, go ahead.
How old is that building?
Well, I don't know about the foundation. I do know they raised that building prior to this latest endeavor with it. And I did go over and I inspected all of the, so there's exchange tanks over there, several, 6 or 7, I think. And for 2 straight weeks, there were something going on with the individual parts to units in certain rooms. So it got a little frustrating, but they brought the plumbers in back to back, and they have been rectified since then. So we just keep our eyes on it.
Because I told Dan Kent that building is too new, and the apparatus out there is too new for that to be happening. So it would have to be, the quality of what was put in there for Dan, for that to be happening so quick and so soon. Because you think, I'm sure that there's a lot of water run there, but you think about a nursing facility, the water is run constantly as well. And those hot water tanks and exchangers or whatever they function. So Dan said that he assured me that they were going to look into it, and I never got anything back from him. So I just wanted to make sure that those people out there are comfortable with their hot water.
Yeah, no, I appreciate that.
I know you do.
I made 2 trips out there and put my hand under the faucet myself. I can't, I can't tell you I really had an understanding of what was going on, because the first week a part was replaced and I was satisfied. And I thought, okay, little parts go. But then the next week, a wholly different part was
another thing went.
Yeah.
So I told him it was shoddy workmanship.
Well, whatever it was, I need there to be hot water at all times.
Exactly.
That is now known. So, so as far as that issue, that's resolved. As far as what's going on with Ed Stifler in your town and their folks, I have not been brought up to date on that.
Nope, me either. So me either, because I know that we're supposed to come out but I did, because I got several emails about the hot water issue. So that's the only reason I got involved. And then I forwarded it to Dan and any other help that I could get. So, because I wanted it to run smoothly for you and your department and all that you do. So,
well, and it's about the clients, and we wanted them to have it. So,
yeah.
I continue to. I mean, I guess I'm encouraged with this latest COVID news that Jack reports this week, and I'm very happy about all of those vaccines. But I really look forward to a time when I can bring this committee out there and take you around and have you ask any and all questions, and have the Galvin staff there for you, so that you can ask them questions. and I've been looking forward to that since its opening, and of course of what we've been dealing with. So, I sure hope that you'll all be available when that opportunity comes around.
I think the issue with Ed Stifler has to do with the front building where they wanted to put the offices in. Is that what you're making reference to?
That was my understanding, and it's that's obviously a critical part of what I would like to get done out there because of all the program area.
Okay.
Now again, because of COVID, the delay's been fine because I wasn't going to be able to bring local providers in, although they're all very interested in locating there from time to time, and so it will become one. So certainly, I'm hoping that whatever issue there was is being ironed out.
Okay. I'll check with Ed on Monday morning.
I appreciate that. Thank you.
Okay.
Thank you. Supervisor Adams?
Thank you, Bob Lagonia.
You're welcome.
I may run out of battery, in which case I'll call back in. But I just had a couple of questions about the stats this month, which I compared to the year-to-date for last year. And sure. I'm looking at application assistance is down 60%, and homeless intake is down 64%. Home care is up 37%. Abuse and neglect cases are up 45% in foster care. And I'm also looking at staffing, which I see that for the same period last year, we had 5 positions that we were trying to fill. And at this time this year, we have 16 staff positions that are open. And I'm wondering how the staffing is affecting some of these statistics.
So, no, good question. Interestingly enough, on the eligibility side, where you see the applications, the number of new applications would be down because a lot of the recertifications continue to get pushed back, which allowed for people just to stay under the care and under the programs they were on. So we probably peaked at some point last year, and all of those folks who were eligible then remain eligible now. So it's actually, that's a good sign to us because new need isn't being created, particularly in a pandemic. You would expect early on for that need to rise and for the state to step up and say, well, listen, once you get them on the rolls, they stay on. You don't have to worry about eligibility. They don't have to worry about, whatever regulations that we hold out in front. We're going to keep research out. So that's a good thing, and I think it speaks to some. On the staffing level in general and foster care, that's never something that goes hand in hand. That is an ebb and flow that I have always liked to keep down. And unfortunately, there were a few cases that were very, very challenging that began just about at the onset of COVID. Families facing some real difficulties and challenges for us. And, if they've got 6 children and 7 children and 4 children, it tends to drive the numbers up very quickly. So that's just an unfortunate rise that is always concerning to me, and I like to see go down. I don't know that staffing, it certainly, I'll say this, when you could spread that out a little bit more, the stress on the staff goes down, okay, because foster care work is extremely difficult work. It's very intensive, and you put a lot into it, and I think there's emotional price to be paid. And obviously, if we've had to keep numbers down a little bit lower, I don't think anything gets missed. But I would, if I had to guess, it takes a bit of a toll emotionally on the worker. Having said that, we're adding some workers this month. So we keep going back down to that baseline of the hiring freeze, but then we keep creeping back up as we did this month. So, if it's going to have an effect, I'm thinking it's having an effect on those folks with these caseloads. And we're keeping a close eye on that.
So if people don't have to recertify, it just means that we don't have new people coming in, that everyone that was in the system is still in the system.
Yeah, or unless they've backed out altogether, perhaps, I have to think that there's some attrition there with people moving, but not much, because, people weren't moving around with COVID. They weren't leaving their counties and their states. So that's correct. What you're having is that they've stayed pretty steady over the time. Some new cases obviously are going to open, but I don't see a drop in the number of cases being linked to anything other than the fact that recertification deadlines have been pushed back. So you don't see a lot of cases close and then reopen. You don't see a lot of cases close and the people move on because, maybe it's just been too difficult during COVID. They're not moving on to new jobs and new apartments. So, probably that's staying pretty steady.
And one other question I had is about the number of children freed for adoption. I see that's up 33%. What do you attribute that to? And I apologize for not knowing more about the adoption process in advance.
Oh, you shouldn't apologize. Most people, unless you work in this building, don't. It's a very good question. That takes a lot of time. That is very court intensive. So you can bet that those are not children new to us. Those are children that have been with us. And unfortunately, despite the best efforts, we have not been able to reunite the family. And so there's a whole process that goes with that, which includes freeing the children for adoption. And as you can imagine, that's a very rigorous process, and it ought to be, because you shouldn't look to free children from their family. You should look to reunite them. And so that process takes years. So what you see now is the result of what would have been happening over the course of 3, 4, and 5 years, and they just happen to be coming through now. So, that's what you're seeing. So you'll see that number be low for quite a while, and it might just be, hopefully it's because lots of families have reunited and our prevention programs are keeping us from removing in the first place. However, it might just be a backlog on the whole process that it takes. And then the courts were shut down virtually to a standstill last spring and into the summer, and that probably spoke to some of it.
So you think it's a backlog?
I think that's in part, but not. Again, I think because it takes so long, the whole process of freeing children so that you're able to adopt them out does not happen quickly. So numbers that you're going to see, say in March of 21, aren't a result of something that occurred in the last 12 or even 24 months.
Okay.
Does that answer your
Thank
question,
you.
Supervisor?
Of course, thank you.
Anybody else?
Yeah, I have a question.
It does, and I think I have a couple of other questions, which I'm going to ask the commissioner offline. Thank you.
Thank you.
Oh, of course, anytime. Thank you.
Supervisor?
Bob, could you make up a list of what the Galvan Center has not yet completed for you so we can understand it? It's always sort of a confusion to me what's yet to be done. And that should include what is happening at for the Kathy's building inspector, what is he needing? So we can understand, and then what are the services missing that were supposed to be delivered, whether COVID stopped it or not, just so we know clearly what we're waiting to have accomplished. That would help. And I'd be curious to know how much you use the St. Charles Hotel for homeless.
We We don't use it at all. And we haven't in my time. I took a meeting with, answering your last question first, took a meeting a few years ago with the manager, and they moved on and do not want to contract with us.
Okay, thank you.
Okay, and absolutely, I'll get that together. And I think it's CO issues predominantly between town of Greenport and Galvin, and I think they were working that out. But I asked, and I think we're just waiting for the update on that. And whatever issues went with that,
I understand that is directly related, but it also relates to the facility that we have a contract with.
Yes. Yeah, no, absolutely. And because I think that there was a question of, is this a use variance? And therefore it will hold up a CO, or is it essentially, no, still a hotel management building, and therefore no problem, here's the issuance of the CO and good luck. And I guess that's what we're all waiting for clarity on, because quite frankly, I would tell you that a big part of this plan was to in fact have offices therein for various purposes.
Bob, I think
council
to step in.
Go ahead.
I think Supervisor Mussman, correct me if I'm wrong, I don't think Supervisor Mussman's asking for the reason they're not completed. She's just looking for a list of things that are not completed that were supposed to be completed based on the contract. We realize there are issues between Town of Ghent, or maybe the building department, et cetera, but just what isn't completed. I think that's just, we're looking for a comprehensive list of that. Is that correct, Supervisor? Sure.
Well, also, if there's something wrong with the facility or it doesn't have a C of O, I would be interested in hearing about that.
Okay.
Yeah, definitely.
Kathy?
And how's the security working out? And is the laundromat working in the kitchen, or did that get closed?
No, those have been working well. With the shift over to St. Catherine Center, it's been going excellent. Just as far as their program is concerned, and they did hire someone to stay into the night, so that was very helpful. So those things are working fine. But I don't think we don't get to use the place as we were going to, and a lot of that was COVID as well. So they're not in their working job searches at computer banks, although the computers are there. So it's a lot of things like that. The other things, as I said, I can put a list together for you, and what's causing that, I may or may not know.
So is there a C of O out there or not?
I do not know the answer to that. I know that was a discussion between Kathy's folks and Galvin.
So can we find that out?
Yeah, I don't know if Kathy's got anything on that. It sounded like she was not sure at this point.
I'm not sure.
Okay, so maybe we can get some of these answers by the next committee meeting would be helpful for sure. Are there any other questions, Bob?
It's all public. Linda, you could ask the building inspector in the town of Greenport. You can always call them and ask them.
I'll check it out. Thank you.
You can always do that. Thank you.
Was there never a C of O? I mean, there had to have been something to move in, right?
As a motel, yes.
Yes, I think they're talking about the offices in the front, whatever. That's.
People are legitimately there as a motel.
Yeah, that's never, as was related to me, that's never been the problem. The problem has been what is the use of the administration building.
Right. That's
I'll submit, if you look at some of the other motels that we're using, this is the crown jewel of those motels.
Well, there's no question as far as the stay, as far as having staff right on site. Absolutely. I think at the end of the day, and again, I can put this list together, the more optimal things, the job search right on site with the computer banks there, the ability to use that room as a community room. The kitchen has been open and they can use that. And obviously the laundry. So it was really more that, and I expect some of that to be solved when it comes to COVID restrictions being lifted. Again, subject to anything, they down at Greenport might say about it, but that's my feeling.
Any other
Thanks,
questions?
Bob.
Thank you.
Thank you, Bob.
Thank you.
Youth Services, Jessica?
Jess?
She's still on, Kelly?
There's someone on the phone ending in 01. She hasn't answered it though.
Does she know she's on mute?
Jessica? Can you call her?
Hello,
No,
can you
5-2.
hear me now?
Yes.
Okay. No, I didn't have an agenda, but I just thought if anyone had any questions about the job description and duties that I sent to the committee that Supervisor Mussman had requested, if anybody had any questions. Are you there?
Does anyone have any questions for Jessica? We asked her to come on to answer any questions if there were any.
I guess I missed the information, Jessica. Sorry. I didn't get.
That's okay. It was sent yesterday.
Oh,
I
yesterday.
just thought it would be like fresh in everyone's mind. But I guess I also wanted to let everyone know that I had a discussion with Chairman Morrell and Chairman Lagonia in regard to any downtime that I might have with the Youth Bureau, if I could help out in any other capacity in any of the other departments, including the Health Department as well as DSS. And I have spoken with Commissioner Gibson about, helping out with any initiatives that he has. I have not talked with Jack Mabb in regard to that to see if he could use me, but I would be more than happy to do anything that they might need help with in my downtime. Also, summer programming has been approved by the County Health Department and packets have gone out. So it's going to be up to municipalities as to whether or not they choose to run summer recreation programs. And I'll be sending an email out to all supervisors in the county in regard to that. So that was the other thing. And Commissioner
Jessica,
Gibson and
on
I
that
are
note
gonna-
about Jessica on summer programs, this is Patsy.
Yeah,
I had a
thank
couple
you.
discussions with other supervisors. We need guidelines as soon as possible so we can do our hiring. I have to find a director and so forth. My program is usually over 130 kids for
Right,
summer
yes.
recreation. So I really need some guidelines of what we're gonna do. So as quick, I don't care if you have to go up to Albany and knock on the door and ask them for the guidelines. I need it, we all need it as soon as possible. So
I did speak with Ed Coons last week, and he said that all of the packets from the health department have been sent out.
Just the
I asked-
applications.
just the application.
Just the
That's it.
applications, not the guidelines. Just the applications went out.
Okay, so I
For the
can check
state.
with him as well.
So
I called
from
the
the-
health department today and they didn't have any guidelines yet. So what I would do if you could, because I know Kelly, she's trying to do them, if we can more than one person can ask for guidelines. He said we can open them up, but we need some guidelines. And I think, if anybody needs to do something, we'll work together and try to get that done as soon as possible. And I already got the packet.
Okay, I can
just-
give him a call and check with him. As far as I know, I don't know that New York State gave any specific guidelines yet, but I can definitely check with him, and they can, we all can look into it and see what they're going to be doing and how they're going to do it.
On my control room call on Friday, which is with all the county execs in the state, I will ask about guidelines for summer recreation programs, and they may not have an answer, but usually they'll get back to me. And
all right, thank you, Chairman.
Yeah,
Mr. Chair, can I address some of that? This is Kevin.
Can I just say one more thing? This is Jess again. It was asked on our Bureau of Youth Development call this morning. And as far as most counties go, most people are just questioning about running swim programs. There hasn't been a lot of information released as to recreation programs in general. And we're really not getting like 100% positive answers from like OCFS and the Bureau of Youth Development. They just keep saying we're waiting to hear from, above, like my state rep is waiting to hear from above.
So I think that, Ed Coons and Jessica, I think they're both aware that the towns have parks that are looking to open, and we have summer programs that we're looking to have kids participate in this year. And I'm sure that any guidelines that come out will be gotten to us as soon as they can get them to us. I don't doubt for a minute that this isn't on the top of their agenda as well as ours. So Jessica, thank you for what you do.
Thank you. Thank you. I also just wanted to say that I did speak with Commissioner Gibson, and we're going to schedule a meeting with Jen Gainey, who's the Director of Services at DSS, and see what help she might need with any youth programming or families, workers that are dealing with youth that I could be involved in as well.
Come on to my house to come on. Kevin
Rob,
McDonald.
You've got Kevin McDonald and Sarah.
Yeah, I just wanted to add, as far as guidelines, we asked the state for guidelines in opening up our senior centers, and we were told that they are not going to give us any guidelines. We have to come up with that on our own. We have to make our own guidelines.
Thank you, Kevin. That's why I think what they're going to say is they're not going to give guidelines.
They don't want to be. They don't want to be responsible if something happens.
Exactly. And that's why I think it's going to go by like municipalities' decisions again, like last year when nobody ran the summer recreation programs except for the city of Hudson. I think if municipalities can do programming and maybe limit the kids for certain periods of time, limit the number, or maybe have programs running at different sites, then transportation becomes an issue. But I think that's what the verdict is going to be, is I think the state is going to say, and the county is going to say, it's up to you as a municipality. The only program that is definitely not running is the co-arc program this summer. That's the only thing that Ed said is definitive, which is really disappointing because that population needs the service.
So even if they say that they're not going to send us any guidelines, that's a guideline. It's like, just tell us that they're not going to do anything, and then we as municipalities can move forward or not.
Correct.
You know what I mean? Yeah. But Jess, I appreciate you and what you do. So
thank you very much.
You're always a phone call away.
Just last year, they gave us a guidelines, which nobody was open. So I'm looking at a lot of those. So that will be somewhat of a help. But I don't think our residents is going to believe us when we say, no, we cannot have 130 kids, I want to cut it in half so we can be social distancing. So we just want to make sure the residents know that we're also doing it the proper way. And I'll be honest, I'm tired of getting yelled at and I yell back, so I don't want to do that.
Jessica,
Yeah, and you do.
Thanks, Jeff.
You don't do that, Pat.
You have a big site out there too. So it wouldn't necessarily not be a possibility for you to run a program, only because you could probably, I don't know what guidelines would be for program equipment, kids being on the train and how do you keep the distance, but you could possibly do some type of programming and have, the kids in different areas at different times, kind of thing. I mean, you run a pretty tight ship out there. It's always been a good program. And you have the different fields. The only thing that I would question is the playground equipment actually being used and how that would be sanitized and things like that. That's the question that we're all asking.
Well, that's the one thing I need to know. I'm not washing down swing sets, I'll tell you that much.
Jessica, I do think, though, that if the state is not going to be giving us any guidance, then many of the towns are going to be looking to you and Ed for guidance. So we're going to have to make that determination. If the state is not going to do it, then the county's going to have to put something out to assist the supervisors so they can make a decision. I think that's where we're kind of at. I don't disagree with what Kevin said, because Matt will tell you, and I can tell you, that there has many times we've asked for guidance and we've gotten a one line back that says there will be no further guidance. But that doesn't mean we can't come up with our own guidance in the county and assist our supervisors in the county. So I think at some point we're going to
absolutely, and I agree, and I don't go out and do any of the inspections and things like that, but I work very closely with Ed and Kaylee before things are sent out, and with what they're thinking. Ed just says we're giving municipalities the go ahead, and it may be that very well that you guys will have to do it at your own risk. I don't know, but at this point we don't have anything from the state, so we can work on something, on the county level, and go from there, I guess. But, my other concern is we're going to get the information out as quickly as we can, because there's a lot of youth that are employed by these programs who may have to seek, alternative employment for the summer as well. We don't want them to, wait until the last minute and say, okay, now I don't have a job this summer either.
Sarah, you had your hand raised.
Yeah, a couple of questions about, I see there's a youth board. I wonder, are they still meeting? And is that ongoing? Are you looking for members, or how does the youth board?
Are you talking about the county youth bureau, the youth?
It says,
or are you talking about the city of Hudson?
Youth board list is county.
My youth advisory board?
Yeah, I guess so.
Yeah. We're always looking for new members. Unfortunately, we haven't really met all that often since COVID started. But we go ahead and, we all correspond via email, and we do have youth members as well. But yeah, we would always like to welcome. We do not have representation from each municipality in the county, which we should actually have. So if you have someone that you would like to be appointed, if you would like to send me the information, name, address, phone number, what their capacity is or what they do in your community, that would be great. Then I send that to the County Board of Supervisors. They approve the person, and then they're appointed.
Yeah, I'm just seeing on this board, I think you're supposed to meet quarterly or something. Maybe you could set up.
Yeah, we did change
meetings.
Correct, we did change it.
Okay. And yeah, on the job description you did send out, I think, is there a civil service description also, or is what you sent out?
The only reason I didn't send the civil service job description is because it's from 1987. It was approved, and that's fine. If you want to take a look at that, you can just go through civil service, or I can get it to you. The information that I sent to you was information in 2017. We were asked as department heads to put together a new job description, because obviously it's drastically changed since, last 1987. But so I just kind of pulled from that. The only reason I didn't send that formally was because it was never actually approved in 2017. So I just pulled from that to put this together when Supervisor Mussman requested it.
Okay.
I didn't want to send something that wasn't approved formally.
Is that something the county needs to follow up on? Service or somebody?
Well, I think they were looking just for updated job descriptions for everyone. I think it was requested for everyone to do because I had several meetings at DSS with the commissioner and with the deputy commissioner to get this done for, I believe it was all department heads.
Right. Okay. All right. That clarifies that. Thanks.
Supervisor Mussman.
Thank you. You're welcome.
I'm sorry I didn't get the chance to look at it before today. It was a little fast for me to look at it quickly. Just what is the whole budget for your department?
My budget has been absorbed by DSS. So I oversee the funding that we get from the New York State Office of Children and Family Services, among, other smaller grants that we get.
So
I don't have my own budget. It's absorbed, it's in DSS's budget. It's included.
Jessica, how much do you get in aid to localities in terms of what you contract out for?
$59,614 is what we got in 2020.
Okay, thank you.
That's it.
And the good thing about that was when summer recreation programs didn't run, we were able to reallocate each municipality's funding to the 11 agencies that we provide funding to that were actually able to provide services for youth in 2020 despite the COVID-19 pandemic.
So this year you oversaw $59,000 worth of grants. Is that correct?
Yeah, and I didn't get the other two grants because of COVID-19. We do a summer performance with the Ellen Sinopoli Dance Company, and we also get a grant from the New York Junior Tennis League to run tennis programs.
So normally, what would a year of funding that you manage be like?
Probably around
60,000.
Close to 59, close to 70,000 probably, just with that funding that we allocate to programs in summer rec.
That's it, 60,000?
Close to 70.
I'm sorry, who's speaking down on the bottom? Ron?
Yeah, just to jump in here. She was totally absorbed by DSS about 4 or 5 years ago. Her funding does run about 70,000 a year from the state. Her salary is about 63,000. But the benefit by absorbing into DSS is that on administrative overhead, we can get 60 cents on the dollar back because she's in DSS's budget. So that's a big benefit to the county for us by having her in DSS. And I'm sure the commissioner's online, he can agree to that.
Yeah, that's right. And when I came on, that move had been made. We've, from time to time, I should say, we also sort of get together on other projects that have been very beneficial, and grants have come in that Jessica told me about. The Safe Harbor is just one good example of that. So we're able to work, together and bring those in. So yeah, I think that's a pretty big benefit to the county. To move the funding over, we act as the pass-through for the money, but then the administrative costs get reimbursed. I didn't know they were at 60%, but that's definitely a benefit.
Supervisor Mussman, did you have other questions?
I have a lot of questions, but it's getting late. I'll come back with some more. Thanks.
Okay, thank you. Are there any other questions from anyone else?
Yeah, I think sometimes, Jessica, it'd be fun to hear the good parts of what you're doing, because we don't get to hear it a lot in committee. You kind of come in and say occasionally, okay, the grants are done, but I like to hear the heartwarming stories or how we've improved the youth and stuff. So it'd be great to hear from you occasionally. Thanks.
Thanks. Can I ask who was just speaking?
Oh, Sarah Sterling.
Oh, okay. Thank you. And I appreciated your support last year in 2020 with trying to get programs running, and we were just lucky enough that we could get the city of Hudson and get their programs going. So I was grateful for that, at least. Thank you.
Does anybody else have any questions? This is a long meeting. I think if there are more questions, we should bring them back up, though, as you said, Supervisor Musman.
I'd be happy if anybody wants to respond to my email, and I'd be happy to meet with anybody in regard to whatever questions they may have.
Thank you.
Thank you, Jessica, for coming out.
All right, thank you.
Does anybody have
There
any?
you go.
I think that's it, Kelly, correct?
Yes, sir.
Does anybody have anything else to bring to the table? If not, I'll entertain a motion to adjourn.
I'll make that motion. Can someone cook for me?
Come on
And
over.
I'm gonna second it. Finish some
Second.
corned beef and cabbage.
All in favor?
Aye.
Thank you, everybody.